Hi, good afternoon, everybody. Congressman Jason Crow joining you here this afternoon. We're really looking forward to providing some very critical information to you all right now as our country and our community continue to deal with an unprecedented public health and economic crisis, the likes of which we have not seen before, both a pandemic with millions of Americans sick, over 210,000 Americans have died as a result of the coronavirus, and tens of millions of folks unemployed. We're seeing a crisis in housing and food security and employment in every facet of our community. So what we have done through my office is we've set up a series of webinar programs to help people with job placement, to help people brush up their resumes, develop skills for finding new jobs. We held a virtual job fair, which was an extension of our in-person job fair that we held last year to help connect people with employers. And today, I'm looking forward to this topic where we're going to cover healthcare enrollment during job transitions, but also what food resources and other resources are available to you and your family that are really important to make sure that your basic needs are being met. Very critical stuff. So we are joined with some experts here in Colorado, people that work for government and nonprofit agencies that spend their lives helping you. And they're going to provide some really important information about resources available to your family. So we're joined with, or by Allison Somerton, the program manager with Aurora Community Assistance Network. Allison, thank you for joining us. Safia El Fatouri, Public Affairs Manager for Connect for Health Colorado. And Ashley Wheeland, the Director of Public Policy for Hunger Free Colorado. And all the guests are great, but I have a special background and have known Ashley, and Ashley and I have been friends for a very long time. So it's very good to have you with us, Ashley, and for all of you to be with us. So with that, I'm going to turn it over to our guests to present this really special information. But before I do so, just a reminder to everyone joining us that one of the most important things that me and my office do is provide constituent services for the community. We have a staff both in Washington, D.C. and in Aurora to provide services to you and your family to help you navigate the federal government. We've actually, in the past year and a half, have completed over 1,100 constituent cases for people in the 6th Congressional District, and have actually returned more than $2 million in owed benefits. And that's owed tax refunds, Social Security benefits, veterans benefits, anything involving federal agencies and benefits. And we're very proud of that work that we do. So if you have questions or challenges, or you have a loved one or a family or a friend that isn't getting their benefits, please give us a call and contact our office, and we'd be happy to work with you to see if we can help. So with that, I'll turn it over to our guest today. And I really appreciate you all joining in, and I wish you all the best safety and security in these challenging times. Thank you.
All right, thank you so much, Congressman Crow, for having us today. We appreciate it. Hello, everyone. My name is Safia El Fatouri. I'm the Public Affairs Manager at Connect for Health Colorado. I am going to talk to you about some of your health insurance options, and then I will turn it over to my colleague, Allison Somerton, who will talk about the different types of assistance that are available to obtain health insurance. So just to give a quick overview of what Connect for Health Colorado is, we are the official health insurance marketplace in Colorado. So what that means is that for anyone who doesn't have access to employer-sponsored coverage, Medicaid, Medicare, or other types of coverage can come and shop on our marketplace and compare the different options side by side. So there are different health insurance companies to choose from. And we are the only place where you can also receive financial help to lower your monthly premiums, as well as get some out-of-pocket help with your out-of-pocket costs. We also have expert virtual in-person assistance available throughout the state. So we have a statewide network of assisters, as well as brokers that are trained and certified through us, and they can help you fill out an application from start to finish. And a lot of them are offering virtual assistance right now. Allison Somerton will get into a little bit more of those details later on. As I mentioned before, we're a health insurance marketplace, so you can compare your options side by side. I often like to compare us to Expedia or Orbitz when you're purchasing a plane ticket or a hotel. You can see all of your options in one place. This is very similar for health insurance options. So as I mentioned, there are different health insurance companies that you can choose from. Those are listed here. So these are for the 2020 plan year. And in 2021, they will remain the same. So as you can see, we've got Friday, Rocky Mountain, Cigna, Kaiser. And then I also wanted to point out that there is a dental option to choose from. So Delta Dental offers several dental products. And then there is a link to vision services that you can find on our website as well. We also have tools on our website that can help you see what your options are, but also show you how much you can save. So if you visit our website at connectforhealthco.com and click on see how much financial help I can get, we have an anonymous tool where you answer just a few questions about your household and your income, and the tool will show you how much financial assistance you might be eligible for, as well as what your different health insurance options would be. We also have tools that allow you to filter the different plans based on preferred doctors that you might have or medications. You can also filter by the different plan benefits. So if there's a specific health insurance company that you would like to shop through, or if there's a specific level of coverage that you are looking for, you are able to filter your options based on that. So typically our customers tend to be individuals who are self-employed between jobs, and that's one of the ones that we wanted to stress here today. So I know a lot of folks are being laid off from their jobs, or hours are being cut, and you are potentially losing your health insurance through your job. And so now is definitely the time for you to look at your options through Connect for Health Colorado and get that in-between coverage until you are able to get a job that offers health insurance. We also tend to have a lot of our customers are working as contractors or small business owners, or working for businesses that don't offer health insurance. So we have a lot of service industry individuals who are able to purchase coverage through us, and also just anyone working part-time. This is not an exclusive list of people who qualify for coverage. Through Connect for Health Colorado, basically anyone who is a Colorado resident and has a lawful present status and is not incarcerated can purchase health insurance through Connect for Health Colorado. Allison will talk about the financial assistance that's available later on in the presentation, and there are specific eligibility criteria for that as well if you are looking for financial help. So with that, I just wanted to leave our contact information here. As I mentioned before, there are several different ways that you can get help. You can visit our website at connectforhealthco.com. We have a lot of different tools available there. You can also find expert in-person or remote help in your area, which Allison will speak to in just a bit, or you can call us. So we have a customer service center that are available to answer any of your questions. They can also help you with the enrollment process, and the phone number is listed here. So with that, I will turn it over to you, Allison. Oh, you're on mute.
Catches me all the time. My name is Allison Somerton. I am a program manager at ConnectAurora. We're at the Aurora Coverage Assistance Network. Next slide, please. And we have been funded since 2013. We are a certified Connect for Health Colorado assistance site. We provide health insurance education and enrollment assistance for residents throughout Aurora and East Denver. And we work with many partners, including Tri-County Health Department and the county, Arapahoe County and Stride, trying to make sure that people not only get coverage, but they know how to receive good care as well using their coverage. Next slide, please. So I'm going to talk about the different programs that we assist people with in application, enrollments, and learning to use and retain their insurance. There are different insurance programs based upon your income and family size. And so for individuals with the lower income spectrum, there is Health First Colorado Medicaid. It is a program for low-income families. Again, the eligibility is based on income. So it would be your tax household, the number of people in the household, and your monthly gross income. Your benefits are available without any premiums, and in some services, there are very low copays. Like your Connect for Health insurance plans, Medicaid covers all 10 essential health benefits. In addition, it covers Medicaid. Medicaid covers dental services for children and adults. One important thing to consider for Medicaid is meant for people who are lower income normally in transition. So if you've lost your job and have no income, there is no open enrollment period. You are eligible to apply for Medicaid anytime. And as long as your monthly income qualifies within the eligibility guidelines, we can help you enroll in Medicaid. Next slide, please. So here are just the guidelines that will be effective in April. So basically, if you're a single individual and your income is less than $1,415, you would be eligible for Health First Colorado Medicaid. And you can see there are slightly different levels of monthly income for children and pregnant women. Again, we're happy to help you with this. Our contact information is at the end of the presentation. So if you need some help figuring out what you're eligible for, we can help you with that. Next slide, please. So the Child Health Plan Plus program is a program for children and pregnant women. It is really meant for children whose parents' employer provided coverage might be more expensive and not as affordable for families. So there's the Child Health Plan Plus program. Again, it is based on your household size and income. And there are an annual enrollment fee, not a monthly premium, but an annual enrollment fee depending upon the number of children in your family. Again, for CHIP, there is no open enrollment period. If you are in need of health insurance for your children, come to us and we'll help you apply. Next slide, please. And again, here's a chart, and I believe these slides will be posted. This chart provides information about the income guidelines for children being eligible for CHIP. So for a person and a household of one, let's say you have a 17-year-old whose income would be $1,511, they would be eligible for CHIP all the way for a family income up to $2,765. Next slide, please. So Sophia talked about Connect for Health Colorado. That would be for individuals whose income would not qualify them for Medicaid. Their incomes would be slightly higher. Financial help is available for these Connect for Health Colorado plans. As you can see, depending upon your family size, for a family size of one, an individual would be eligible for financial assistance if their income was up to $51,000. For a family of four, that would be $104,000. Many people don't think they are eligible for financial assistance. It's important to connect with a assistance site like ConnectAurora or go onto the Connect for Health Colorado website to explore your options because financial assistance really does help you reduce the cost of your premiums. One important thing I'd like to emphasize is that the only place you can get financial assistance for marketplace health insurance is on the Connect for Health Colorado website. And our team at ConnectAurora can help you with that, as well as the folks at Connect for Health Colorado. Next slide, please. When you are in transition, if you have lost a job and you've lost your employer health insurance, you can enroll in a Connect for Health Marketplace plan within 60 days of losing that coverage. So if you lost your coverage on September 1st, you will have till the end of October to enroll in a plan that would become effective November 1st. In addition to having a job loss, there are other conditions that would qualify you for a special enrollment period that would provide you 60 days to enroll in a health insurance plan. And those are listed here. But for example, if you have a young adult who is aging off of your employer plan, that would also qualify that individual turning 26 to enroll in a Connect for Health Colorado plan. The other time that you can enroll in health insurance is during open enrollment. If you have all missed a window and you are not, and you missed that 60-day period when you lost your insurance, you can sign up for coverage beginning November 1st through January 15th. And that coverage would be effective if you enrolled by December 15th, that coverage would be effective January 1. So again, open enrollment begins November 1st of this year. Just want to explain there are two different types of financial assistance. There are premium tax credits, which help reduce your monthly payments that you pay in premiums. And we will provide that chart on the next page. And the second type of financial assistance are cost sharing reductions. They help reduce your copayments and deductibles and are available to people between 133 and 250% in the federal poverty level. The chart on this next slide displays the income that that qualifies you for the financial assistance. So that first column, if you're a household of 2 and your income is under $43,000, you'd be eligible for extra help reducing your copayments and deductibles. If you're a household of 2, you would be eligible for financial assistance to reduce your premiums as well, as long as your income is under $68,960. I'd like to emphasize that you don't have to memorize these numbers. They're posted on Connect for Health Colorado, and they're on our website. And if you have any questions about whether your income qualifies, we are here to help you in Aurora. Next page, please. We have a scheduling tool on our website at ConnectAurora.org, and you can actually schedule an appointment for either in-person or virtual assistance. We assist people on Zoom, like this webinar. We can help you apply and explain what your coverage options are over Zoom as well. When you schedule an appointment using the scheduling tool in ConnectAurora, you can select an appointment for either in-person or virtual assistance. These are different locations that we offer assistance to folks and the languages that we offer assistance as well. We're happy to help you. Just give us a call or go online and schedule an appointment. And if it is a situation that we cannot help you, we often refer and work closely with brokers and can refer you for help with brokers, or we'll refer you to the Connect for Health Colorado Assistance site. Again, my name is Allison Somerton, and we're happy to help you at ConnectAurora, and my contact information is on the next slide. Thank you very much. Oh, one more thing. We are a program within the Aurora Mental Health Center, and of course, we are more than happy to help people connect to mental health services as well.
All right, I think that we can turn it over to Ashley now to talk about the services that she offers.
Great. My name is Ashley Wheeland, and I am the Director of Public Policy for Hunger Free Colorado. I work with an amazing team here at Hunger Free who actually do the services. I do the more of the policy side, and wanted to fill you in on what's going on federally on hunger programs, as well as give you some information on the how you can get connected with us, and we can help connect you with these federal programs. So why don't I go ahead and share my screen and pull up the right thing. You never know what you're pulling up, right? All right. So federal programs, our hotline, which I have down at the bottom of this slide, the phone number as well as our website that has a lot of answers around what's going on with food and nutrition programs in Colorado and across the country. And there's quite a bit, we'd like to see continue to happen, and happy to work with the congressman on those things. The food program that most of you have probably heard about and know about is called, that you might have used to have been known as food stamps, is called SNAP, the Supplemental Nutrition Assistance Program. And this program helps and provides folks with EBT cards to buy food. And so if you're under a certain income level, under 133% of federal poverty, you can apply for that program. You do go through an interview process and have forms to fill out, which that is exactly the kind of help our hotline provides. And there's things that they consider, like how much your bills are, what your medical costs are, those different pieces to qualify for SNAP. Right now, with the COVID pandemic and the issues happening, you used to have to go in person to apply for SNAP. Now you don't. You can do it telephonically through the telephone and work with our folks. And then also everyone is getting the maximum benefit for SNAP. So whatever the allotment is based on your family size and your income, family size, actually you get that amount. So for example, one person right now, because of COVID-19, qualifies for around $200 of food assistance. And that's going to be in place as long as the pandemic is a health emergency at the state and federal level. So it's really a good amount of food assistance, and some people in the past may have applied and gotten, a lot less, and so don't think it's worthwhile. Right now, it is definitely worthwhile for folks who are facing some hard times during the pandemic as the economy, we're working on the economy in pieces. Another program that some of you may have heard of that usually you hear about it for pregnant women especially, is called WIC, the Special Supplemental Nutrition Program for Women, Infants, and Children. And this program is for low-income pregnant women and mothers and children under 3. So you want to apply and keep it. Right now, a lot of folks don't stay in the WIC program. So after they have the child, and the child's about a year old, because that's when children move off of formula. But a lot of people do not know that WIC can continue to provide some food assistance and other pieces. So definitely participating in the WIC program. And right now there's also waivers in place because of COVID-19. So they used to require you to go in person to apply for WIC. Right now you can do it over the phone. So if you or your family qualify, definitely taking advantage of that program. There's the CACFP program, which is the Child and Adult Care Feeding Program. And those are those programs that the federal government helps cover for after school programs and senior centers. And of course, during COVID-19, we can't do those in person. So there's a waiver that has allowed a lot of those sites to create box meals and to deliver meals. And so if you are needing access to food, and you might be able to participate in one of those CACFP programs, and our hotline can help with that as well. Another program that's actually right now really busy is the National School Lunch Program. Right now is the time for parents to apply for a free and reduced lunch. And a lot of parents aren't applying because their kids are doing homeschooling, or doing school through the computer. And so, but actually those applications are vital for the funding for schools. That's actually how the number of children who are part of the free and reduced lunch program, or how schools receive what's Title I funding for their schools. And so it's really important that parents apply for the program. And so if you haven't, and you because your children are learning at home, please do apply. It will help your school with the funding for the next year. There's another program that was created because of the pandemic that was just extended by Congress. Congressman Crow supported and voted for it, and we thank him for that. It's called the Pandemic EBT Program, and that program is for students who qualify for a free and reduced lunch but are not in school right now. This program provides a certain amount of dollars for their families to be able to buy food. And it doesn't have to be food that for free and reduced lunch times, but also food for dinners and other pieces. So it's a really great program. It was in place, an application just ended for it that basically provided $279 per child and the free and reduced lunch program between March and May. And with the Congress extending it, there'll be similar dollars for families to apply for. So Colorado has received around $50 million worth of funds for families to buy food through that pandemic EBT program. So we're really excited to see it continue and also help some families that didn't get to enroll in it over the summer. So please pay attention. And I know the Congressman has shared a lot of resources about it as the application opens, and when it opens again, I'm sure he will. And then there's also summer meal programs where parents can pick up meals, and those were in place during the pandemic and through the summer. And we had some waivers that allowed parents to pick up the meals. It used to be the children had to pick up the meals. Now parents can pick up the meals, and it actually, the National School Lunch Program and the Summer Meal Program work pretty closely together, but right now there's universal meals. So if a family needs food, they can go to the school and get it. There's not a process of applying. You can go, the waivers allow you to go pick up food. So it's, the Congress has done a lot to help children get food through this, and definitely important to utilize it. Our hotline can help your family determine what you can qualify for. You can call that number below, or you can check out our website, that cofoodfinder.org is updated to really respond and explain what's going on with food resources during the pandemic. So we're here to help and get you connected with what would make the most sense for your family as we all cope with this difficult time and move forward. And that's what I have for you, just one slide.
Thank you, Ashley. So I just wanted to, for all participants, if you have any questions, you can use the Q&A function at the bottom of your screen and ask your questions through there, and we'll take a look at those. While we're waiting to see if any of our live participants have questions, we have a couple that came in before about Medicaid. So I'm going to go ahead and ask those. The first one is, if you lost your job and you were qualified for Medicaid and you got on it, but then you got a job, what happens? Oh, you're muted, Allison.
I'll be happy to take a try at that one and let anybody else add to that. If you're already on Medicaid and you've gotten employer insurance, the most important thing is to go into peak and report that income change. But right now, because we're in a public health emergency, you are not being disenrolled from Medicaid for having a higher income, and you will retain that Medicaid until the end of the public health emergency, which right now is scheduled to be at the end of January. So you can retain your Medicaid until the end of that PHE, but it really is important to keep your Medicaid information up to date.
Great, thank you. So one other question about Medicaid is, if you enroll in it, you say they contact your office and get enrolled, how long does it take before it's effective?
Good question. So in many cases, an individual applying for Medicaid can get a real-time determination. And so if you apply in the middle of the month, your enrollment or your eligibility for Medicaid and your enrollment usually begins at the beginning of that month. And even if it takes several weeks, for example, if they needed verification of your citizenship or needed you to upload your Social Security card, your eligibility, when you're approved, would become effective in the beginning of the month in which you applied.
Great, thank you. So this is a question for Sophia, I think, or maybe both you could answer. Similarly, if you applied for or got health insurance through the Connect for Health website and you were receiving some assistance financially, but then your income changes, your job, or you get a job and now you have employer offered insurance, what do you do to either report that change or change your insurance, or what should people do?
Yeah, that's a great question. And it's very similar to the process that you would go through to report changes to Medicaid. So you would log into your Connect for Health Colorado account, update your income information, let us know what your new income will be. And one thing that I want to emphasize is that the income that we look at Connect for Health Colorado for financial help is based on your projected annual income for the coverage year that you were in. So for example, if you apply today, we will be asking you what your income will be for all of 2020. So you'll want to report all of your income from January up until now, and then also any predicted income for the rest of the year. And so when you do get a new job and you get new income, you'll report that information to us and we will rerun your eligibility. Usually if you have access to affordable employer-sponsored coverage, then you are not eligible for the financial help through Connect for Health Colorado anymore. So we will rerun your eligibility and let you know that you are no longer eligible, and then you would terminate your coverage prospectively. So if you came in today and reported that you got a new job and that you need your health insurance to end, it would end October 31st. So everything is prospective, and the best thing to do is just make sure to stay on top of reporting any types of changes that happen with your household, and we will rerun your eligibility. And also that's why assistance sites like Allison's are here. They can help you report any type of information through the website and answer any of those questions for you as well.
Great, thank you. So those are all the questions that I have now. If anyone in the webinar has a question they want to ask, you can use the Q&A function. Otherwise, if you have any other information you wanted to share, any of our presenters, we'd appreciate that.
This is Allison. I would like, just as Sophia said, to encourage people, whether they're on Peak or Connect for Health Colorado, to update their income status. If hours change for even a month or two in your employment, or if you're self-employed and you have a bad month or you have a really good month, it's really important to keep that information up to date in your account, especially for the tax credits, so that you will not have to pay a lot more back at the end of the year if your income did go up. For example, if you're self-employed and things were really slow in June and July, but things started to really pick up in September and October and November, and your income was much higher, it would be better to report that income change to reflect what that would be, so we don't end up paying tax credits back at the end of the year. And we'll be glad to help you with that.
Thank you, Allison. That's helpful. That is a question we get around tax time when people get that information that, oh, now they have to pay something back. So thank you for bringing that up. Okay, well, I don't see any other questions. And so I guess that's it, unless anybody wants to add anything else. We really appreciate you being here and taking the time to explain all of this. I know it's complicated, and so it's great that you're a resource. People can contact you, and we'll have that information available on our Facebook page, and this video is recorded so we can post it and people can watch it again. So thank you so much for being with us today. We really appreciate it.
Thank you very much.
Thank you for having us.
I wish everybody good health.